Hey guys, I just wanted to welcome you to the Active Kidney again. I'm actually working today, so driving around. I'm just leaving Robstown, got a customer out here. I wanted to touch base with you guys, let you know what was going on in my life with my kidney. I actually had a blood test and a sonogram just yesterday. Got my blood results back. I had been at a 1.5 creatinine, which was getting a little dangerously high, kind of creeping up as it were, and the doctor was kind of concerned about that. So we had a sonogram later in the afternoon. That sonogram showed that I had a little bit of what the technician called hydro, which is a little bit of urine kicking back into the kidney. We're gonna see how that pans out, what the doctor says about it. But supposedly it was just a small spot, something that does happen, so we'll see what goes from there. But I did get my blood results back, and yeah, I'm actually at a 1.4 creatinine instead of a 1.5. So my creatinine was going down. That's positive. That could have been attributed most likely to my increase in water. I had actually been doing about 3.5 liters more or less. What is it? Forget the calculation I put to it, but somewhere around, I usually do it in terms of 360 ml or 720, because that's actually the size containers that I usually use, like a 25-inch or a 25-ounce water bottle that I use for cycling, so that's about 720 mLs. So yeah, I upped it up another 720 from the 3,600 mLs. So now I'm at like 4,300 more or less, and so that seems to be working out. Maybe that's what's causing my creatinine to go up, go down, etc. So yeah, I'm going to continue that and see how that continues for me, see how that works out. Also adding fluid when I'm working out, most obviously. I calculate more or less that I'll go through a water bottle, about 720 mLs, every 30 minutes. So I try to do about 1,442 mLs every hour. I know I'm getting kind of in the technical weeds here, but I just thought I'd let you guys know that. That seems not to be hydrating me so well, so I'll actually follow it up with another water bottle after my indoor exercise or even my outdoor exercise. So I'm gonna start doing that as well. So yeah, just trying to stay hydrated. I think, we've known this from the very beginning. You've probably been told this by the doctor. Hydration is definitely key in regards to recovery, to getting that kidney to work properly and to respond to your body. So I'm gonna continue doing that, continue hydrating, and see where that takes me. Yeah, a little bit also, I was talking to the technician there, and I maybe I've said this on the channel before, but being a PKD patient, sometimes you have to realize that you're just a little bit different than most of the other patients that are usually seen for CKD or chronic kidney disease. You're there not generally because of any sort of continued lack of monitoring your blood sugar or all the other complications that come with that, in regards to blood vessels or anything else. So, you're not losing limbs, you're not having to worry about your healing, you're not having to worry about all those other things that diabetics have to, and some of the things I don't even know they have to go through. But yeah, so I was talking to her, just kind of reminded me of something I said to you guys about polycystic kidney disease, and that's the fact that your kidneys are pretty big. And so I think I told you the last time that the third largest kidney in the world came out of India, and it was 13 pounds. Just one kidney, 13 pounds. So 2 kidneys, 26 pounds. Yeah, it's just amazing to think that those things get so big. My aunt had her kidneys taken out, like I had said before as well, and I don't know how big hers were, but man, it's just crazy to think that your kidneys can get that big, that over time like that. So yeah, take that into consideration. Let people know that. I always try to be very informative with all those texts, and just tell them that, you know, I'm not their typical patient that they see. In fact, she told me, you know, how many sonograms have you had this whole time that you've been on with your new transplant? And I told her, out of the 5 months, and this is to be honest, out of the 5 months that I've had my transplant, I've only been up to date 3 times to get a sonogram. And she was telling me that apparently people get way more sonograms than that. And so it gives me hope that my kidney's doing well. I feel that it's doing very well. And so yeah, that's where that is, right? Yeah, what else to say to you guys? Well, I think that's pretty much it. I'm going to be talking to my therapist pretty soon, actually, coming this Friday. And yeah, if I haven't recommended it yet, I recommend that you guys seek out therapy. I was talking with a coworker of mine, and he had lost his father, I want to say about a year ago. And it was a big thing for him. Now, I don't want to equate having a kidney transplant to the loss of a parent, to the loss of a loved one, but it is some transition in your life. It is something that you have to go through, something you have to process that you wouldn't have otherwise had to. You know, you're coming from a life of either kidney failure or dialysis to a life now where you can move, you can be active, you can do things. So you kind of have to mourn that loss sometimes, or just understand where you are currently in this point in life and what you want to get out of life. It's a big change. So, I mean, I know for me, you know, having the ability to get back into cycling, it was monumental. It's changed my attitude, it's changed my outlook. But then I also have to deal with my spouse, who is a very nervous person, and that's not a fault of hers. You know, she's just really nervous about things, and I want to be completely open with her and completely, you know, let her know what's going on in my health. But there's some things that I can't freely tell her because she'll make me more nervous about it. And if you have someone in your life like that, that's maybe, you know, causing your anxiety to go up because, you know, you telling them a particular thing, whether it be negative or positive, is causing them anxiety, then you need some help. And so I burden my therapist with that. So instead of burdening my wife during that time, or my father, who's also the very nervous type, I burden my therapist. And so she's the one that helps me through these things. She's the one that I can talk to. I've been dealing with her for years, but, you know, through this time especially, it's allowed me to get things off my chest I otherwise wouldn't be able to with my circle of contacts and friends. So yeah, therapy. I use BetterHelp. I know it's advertised. I don't even have a follower, so I can't tell you that I could advertise it and I get some code or something. But yeah, it's definitely something I do, and definitely something I like. But anyway, just wanted to keep you guys up to date. And so again, thanks for watching. Click like, make some comments. I just want this to be a part of my daily life, and hopefully can be a part of yours. And yeah, if I can have any if you have any questions that maybe I can answer, or maybe anything else that you think I should be talking about, then let me know. All right, we'll talk to you guys later, and in the meantime, stay active.